One of the most dangerous aspects of syphilis is that symptoms can disappear for years, making people think that they are cured, while this infection is actually progressing silently. So in today's video, we are going to be looking at this bacteria called Treponema pallidum, that's syphilis. What syphilis does to your body, what it does to you as a pregnant man, how it can affect your baby in the womb. Syphilis is a sexually transmitted infection caused by a bacteria. Now listen, this infection is usually spread through anal sex, vaginal sex, oral sex, especially when a person comes into direct contact with a person that has syphilis sore. These sores may be visible on your genitals region, your anus, your rectums, your lips, or even inside your mouth. What makes syphilis particularly dangerous is that symptoms can disappear for years, while this infection, this bacteria remains active in your body. Without proper treatment, syphilis can cause damage to your brain, can cause brain damage, nerve damage, even blindness in severe cases, can affect your heart and other organs in your body. A pregnant woman with syphilis can also pass this infection to her unborn baby. Syphilis is especially dangerous during pregnancy, and you know why? Because this bacteria can cross the placenta and infect that developing baby inside the womb. This is known as congenital syphilis, a serious condition that happens or occurs at any stage of pregnancy. Without treatment, syphilis can cause devastating pregnancy complications, including miscarriage, where the pregnancy ends before the baby can survive outside the womb. This infection can also cause stillbirth, where the baby dies inside the womb after 20 weeks of pregnancy. Syphilis during pregnancy can cause premature birth, causing the baby to be born too early and face additional health risks. Now listen up, babies born with congenital syphilis may appear healthy at first, but may later start to have health issues, health complications such as bone or joint deformity. Some babies may later start to experience hearing loss or even deafness, while for others, blindness or vision problem. While for some babies born with this congenital syphilis, they may experience enlarged liver or spleen. Some may have problem developing, like they have developmental issues. What about brain and nerve damage? That is why as a pregnant woman, you need to protect yourself. You need to protect your baby. Pregnancy is a delicate condition, this delicate stage of a woman's life. If maybe you're not sure of your partner, you can use protection so that that baby will not be at risk of having all these deformities. This is why health experts recommend every pregnant woman to be tested of syphilis during pregnancy, even if she feels perfectly healthy and has no symptoms. The good news is that congenital syphilis is largely preventable. Now we're going to look at how this bacteria, this syphilis, progresses through the body. Syphilis develop in 4 major stages. Now, stage 1 is a primary syphilis. For stage 2 is a secondary syphilis. Stage 3 is a latent syphilis, while stage 4 is a tertiary syphilis. Each stage has its own symptoms, how this bacteria behave in each stages, the timeline, the risks involved. Now, for stage 1, primary syphilis usually develop from 10 to 19 days after exposure. Most people notice symptoms around 3 weeks after infection. The first sign is a sore called chancre. This sore typically appears where the bacteria enter through the body. It may be found on the penis, the vulva, your cervix, your anus, the rectum, even your lips or your tongue. The chancre, that's the sore, is often painless because it doesn't hurt. Many people ignore it, while for some, they might not even notice it. The sore usually heals on its own within 3 to 6 weeks. Unfortunately, this disappearance of the sore does not mean that the infection is gone. This bacteria continue to spread through the bloodstream if left untreated. Several weeks to a few months after the chancre, that's the sore, has disappeared, untreated syphilis progresses to the stage 2, which is secondary stage. At this point, this bacteria has spread throughout the body. One of the most characteristic signs is a rash. This rash usually appears on the palm of the hand and the sole of the feet, although it can occur any part of the body. Now, other symptoms of secondary syphilis include fever, swollen lymph nodes, headache, fatigue. Some persons will notice sore throats, muscle ache, weight loss. These symptoms can last several weeks and may go and come over a period of months. Just like the first stage, symptoms may just disappear even without treatment. After the secondary stage, syphilis progresses to what we know as the stage 3, that's the latest stage. Latest means hidden. There may be no symptoms at all. A person can look completely healthy and feel perfectly normal. This stage may begin within the first year after infection and may continue for many years. In some individuals, this stage of syphilis can last 10 years, 20 years, or even 30 years. Although there is no symptoms, blood test still remains positive, meaning that this bacteria is still present inside the body. For pregnant women, this stage remains dangerous because this infection can still be passed on to that unborn baby. That is why if you are trying to conceive or maybe you want to get pregnant, it is advisable for you to treat infection, treat existing infection, go for a screening test to know if you have any form of STI that can affect your pregnancy, that can affect your baby, or that can cause any deformity during pregnancy. So some of the miscarriages and pregnancy complications that women go through during pregnancy can be as a result of untreated infection. Yes, you heard me. When you don't go for screening tests, or maybe when you allow an infection to be in your body for months, for years untreated, it can start to cause complication during pregnancy. And syphilis is not left out. Now, for the fourth stage, which is a tertiary syphilis. Now, listen up. Not everyone with untreated syphilis develop tertiary disease, but when it occurs, the consequences can be severe. This stage usually develops 10 to 30 years after the initial infection. By this time, this bacteria may have caused extensive damage throughout the body. The brain and the nervous system can be infected, leading to memory loss, personality changes. At this fourth stage of syphilis, some persons may notice loss of coordination, difficulty walking, or even paralysis. Even the eyes can be affected, leading to vision loss or total blindness. At this stage, when the person decides to treat this infection properly, it can stop further damage. But you see, some of the damage that has already occurred before the actual treatment may be permanent. Syphilis is a serious infection, no? But it is also one of the most treatable and preventable sexually transmitted infections. So you have nothing to fear when you get tested and start your treatment early. You don't have to allow this bacteria to damage your system before you start treatment. This bacteria can be treated, can be prevented. And for my pregnant mothers, make sure you protect yourself and also your baby. Go for regular screening tests. Now, if you find this video helpful, don't forget to give a thumbs up, like, subscribe, and share. Bye.